Diabetic ketoacidosis, or DKA, is a serious complication of diabetes. It is a condition that requires immediate medical attention and can be life-threatening if not treated promptly. DKA occurs when the body doesn't have enough insulin to allow glucose to enter cells for energy. Without sufficient insulin, the body starts to use alternative sources of energy. Insulin is a hormone that helps your body use glucose, a type of sugar, for energy. It acts like a key, allowing glucose to enter cells. Without enough insulin, your body starts to break down fat for fuel instead. This process is known as lipolysis, and it leads to the production of fatty acids. These fatty acids are then converted into ketones, which are acidic chemicals. Ketones can be used by the body for energy, but they also make the blood more acidic. When ketones build up in the blood, it makes the blood too acidic, a condition known as acidosis. This can disrupt the normal functioning of cells and organs. This is dangerous and can be life-threatening if not treated promptly. Symptoms of DKA can include nausea, vomiting, abdominal pain, and confusion. DKA is more common in people with type 1 diabetes, but it can also occur in people with type 2 diabetes under certain conditions. People with type 2 diabetes can develop DKA, especially if they have certain risk factors such as prolonged illness, infection, or inadequate insulin therapy. These risk factors can include illness, infection, and certain medications that affect insulin levels or glucose metabolism. It's important to manage these factors to prevent DKA. Understanding DKA is crucial for anyone living with diabetes. Education and awareness can help in recognizing the early signs and symptoms of DKA. Knowing the warning signs and seeking prompt medical attention can be life-saving. Early intervention can prevent complications and improve outcomes for individuals with diabetes. DKA, or diabetic ketoacidosis, is a serious medical condition that requires immediate attention. It is a potentially life-threatening complication of diabetes that occurs when your body starts breaking down fats at an accelerated rate. When ketones, which are acidic substances, build up in the blood, it can lead to a range of complications. These ketones are produced when the body uses fat for energy instead of glucose. These complications can affect multiple organs in your body, including your kidneys, liver, and brain. The impact on these organs can be severe and requires prompt medical intervention. One of the most immediate dangers of DKA is severe dehydration. This occurs because high blood sugar levels cause the body to eliminate excess glucose through urine. This process leads to frequent urination and significant fluid loss. As the body loses more fluids, the risk of dehydration increases, which can be dangerous if not treated quickly. This dehydration can be severe and even life-threatening if not addressed promptly. Symptoms of dehydration include extreme thirst, dry mouth, and weakness. Beyond dehydration, DKA can cause an imbalance of electrolytes in your blood. Electrolytes such as sodium, potassium, and chloride are crucial for various bodily functions. Electrolytes are minerals that are essential for proper heart, muscle, and nerve function. An imbalance in these minerals can lead to serious health issues. An imbalance can disrupt these vital functions, leading to symptoms such as irregular heartbeats, muscle cramps, and nerve problems. In severe cases, DKA can lead to coma or even death. Immediate medical treatment is crucial to manage and reverse the effects of this dangerous condition. Recognizing the symptoms of DKA is crucial for early intervention and better outcomes. The symptoms often develop gradually and worsen over time. One of the most common symptoms is excessive thirst, known as polydipsia. This intense thirst is the body's way of signaling severe dehydration. Frequent urination, also known as polyuria, is another hallmark symptom. As the body tries to flush out excess glucose, it produces large amounts of urine. In addition to thirst and urination changes, individuals with DKA often experience nausea and vomiting. These digestive symptoms can further contribute to dehydration and electrolyte imbalances. Other symptoms include weakness, fatigue, and confusion. Diagnosing DKA involves a combination of physical examination and laboratory tests. This comprehensive approach ensures that all aspects of the condition are thoroughly evaluated. Your doctor will ask about your symptoms and medical history, especially your diabetes management. They will want to know how well you have been controlling your blood sugar levels and if you have experienced any recent illnesses or stress, which can trigger DKA. A blood test is essential to measure your blood glucose levels. This test provides a snapshot of your current blood sugar levels, which is crucial for diagnosing DKA. Significantly elevated blood glucose is a key indicator of DKA. high blood sugar levels can lead to serious complications if not addressed promptly. Your doctor will also check your blood for ketones, which are a byproduct of fat breakdown. The presence of ketones in the blood is a critical marker for DKA. In addition to blood glucose and ketones, your doctor will order an arterial blood gas test. This test helps assess how well your lungs are able to move oxygen into the blood and remove carbon dioxide from the blood. This test measures the acidity, or pH, of your blood. The pH level indicates how acidic or alkaline your blood is, which is important in diagnosing DKA. In DKA, the blood becomes more acidic due to the buildup of ketones. This increased acidity can affect various bodily functions and needs to be corrected quickly. Electrolyte levels are also checked through blood tests. Imbalances in electrolytes, such as sodium and potassium, are common in DKA and need to be managed as part of the treatment plan. Section 5. Treating Diabetic Ketoacidosis. Treating DKA typically requires hospitalization to stabilize your condition and address the underlying causes. The primary goals of treatment are to rehydrate your body, lower your blood sugar levels, and restore your electrolyte balance. Intravenous fluids are essential for rehydration. These fluids, often containing electrolytes, are delivered directly into your bloodstream to replenish lost fluids and restore electrolyte balance. IV fluids also help to dilute the excess glucose in your blood. Alongside rehydration, insulin therapy is crucial for lowering blood sugar levels and stopping ketone production. Insulin is typically administered through an IV to ensure rapid and effective action. Section 6. The importance of fluids. Fluid replacement is a cornerstone of DKA treatment. When your body doesn't have enough insulin, high blood sugar levels draw fluid from your tissues, leading to dehydration. Intravenous fluids are the most effective way to rehydrate quickly. The type and amount of fluids will depend on your individual needs and the severity of your dehydration. Your doctor will monitor your fluid intake and output closely. IV fluids not only restore hydration, but also help to dilute the excess sugar in your blood. This dilution helps to lower blood glucose levels gradually and safely. Section 7. Insulin, the key to treatment. Insulin is the key to treating DKA because it allows your body to use glucose for energy again. This action stops the breakdown of fat and the production of ketones. During DKA treatment, insulin is typically given intravenously at first. IV insulin works quickly to lower blood sugar levels and reduce ketone production. Once your condition has stabilized, you may transition to injections of long-acting insulin. Your doctor will determine the appropriate dosage and type of insulin based on your individual needs. It's important to continue taking insulin as directed by your doctor, even after you leave the hospital. Section 8. Correcting electrolyte imbalances. Electrolyte imbalances are common in DKA and can lead to serious complications. Electrolytes, such as potassium, sodium, and chloride, are essential for many bodily functions. DKA can cause electrolyte levels to become too high or too low. Your doctor will monitor your electrolyte levels closely through blood tests. Treatment involves replacing lost electrolytes through IV fluids or medications. Correcting electrolyte imbalances is crucial for restoring heart, muscle, and nerve function. Your doctor will carefully adjust your electrolyte levels to ensure they remain within a healthy range. Section 9. Preventing DKA, a priority. Preventing DKA is essential for people with diabetes. By taking steps to manage your diabetes effectively, you can significantly reduce your risk of developing this serious complication. One of the most important things you can do is to monitor your blood sugar levels regularly. This involves checking your blood sugar as directed by your doctor, especially when you're sick or under stress. Another crucial step is to take your insulin and other diabetes medications as prescribed by your doctor. Don't skip doses or adjust your medication without consulting your healthcare provider. Section 10. Managing diabetes, your best defense. Managing your diabetes effectively is your best defense against DKA. This involves a multifaceted approach that includes medication, lifestyle modifications, and ongoing communication with your healthcare team. Following a healthy diet is essential. Work with a registered dietitian to create a meal plan that meets your individual needs and helps you maintain stable blood sugar levels. Regular physical activity is also important for blood sugar control. Managing stress is also crucial as stress hormones can affect blood sugar levels. Explore stress reduction techniques such as deep breathing, meditation, or yoga. Section 11. Seeking help and staying informed. If you experience any symptoms of DKA, seek immediate medical attention. Early recognition and treatment are vital for preventing serious complications. Don't hesitate to call 911 or go to the nearest emergency room. Staying informed about DKA is essential for all people with diabetes and their families. Talk to your doctor about DKA, its symptoms, and prevention strategies. Remember, knowledge is power when it comes to managing diabetes and preventing complications like DKA. By taking an active role in your health and working closely with your healthcare team, you can live a healthier life with diabetes.